professional cyclists and skiers. I developed this exercise so they could effectively develop their hip range and their hip flexor mobility. It's a really simple exercise, and it's going to be directly applicable to anyone in a sedentary job that requires them to sit all day. We start with a broomstick, a golf club, an umbrella will do as well. We get into a kneeling position. Really good idea to have some support under your knee to protect that kneecap. Our front foot is neither too far in front or too close, but a comfortable distance, so that if we were to lunge, that we can still maintain a vertical tibia like so. You want to line the knee, the front foot and the back foot in one complete line there. The first position is to just check that when we're in that position there we can maintain balance. If our arms are up here, we're not getting the best information from our hip capsule about where the body is in space and time. So always check in with that and compare left to right side. The second position is to take the bar and place it on top of your head, just behind the crown. Now hands bent at the elbow 90 degrees. In that position there, again, check your balance. You're going to rotate the upper body as far as you can, firstly to the inside of the bent knee, all the while maintaining our posture. As we get to our range limit, you're going to feel like the body wants to do this, and the bar will push into your head. Don't go beyond that point. Go just to the point where you feel that, and in that position we just add a little lunge like so, and then come out of that. Go a little further, and then a little lunge like so. We're going to come through this 3 times on this side, adding 1 or 2% more rotation, and you'll often feel a stretch here in the capsule, the hip, sometimes in the adductor, and the opposite hip flexor. Third position, from neutral here, rotate to your right. Again, just to the point where you feel the bars pulling down and your posture's being changed. And we lunge again. Come out of the lunge, rotate that way some more, and then into the lunge. This will change the position of the stretch to be more of the outside of the capsule and deeper into the hip flexor there. Often we'll see if you have a tight hip capsule, that when we rotate to the right and try and lunge, that the body will try and put us around some tightness there. And that is defeating the purpose of the exercise. We want to maintain a line between the hip, the knee, and that ankle as much as we possibly can, and lunge through that line once we've got tension on. So lunging through like that. That'll increase the depth of the stretch. So if you're not feeling a stretch, it may be because your body's pushed the hip out like that to try and get the movement. So we're using our lower back, which is not ideal. And we swap sides. There'll be one side, one direction that perhaps feels quite tight. Check your balance again. We go through this. The arms are at 90. We rotate towards the side of the bent knee first as far as we can. Then lunge. Try and maintain that and come back a little further, and then back and a little further. Down, and then we're going to go back to the centre. Same to the other side as far as we can. And then down, and then back, and 3 times on that side. The one that you find of the 4 positions that's the tightest or giving you the most difficult staying balanced is the one to work on. By working on it, I don't mean forcing the rotation and not breathing. Go to the point where you feel like the posture wants to change, and just back off slightly, spend some time moving in there, and then go a bit deeper. Surprisingly quick how this will release tension and how the hips will open up on this. A go-to exercise morning and night to undo any office job.